Nurses and doctors of Reddit, what is your back quote they never taught this in school moment? This one was fun. Patient in gets a standard urine drug screen. Positive for ethanol, alcohol. Patient insists he does not drink alcohol. Test is repeated. Positive. Patient is very upset. He does not drink alcohol. Blood test is drawn. It is negative. We checked everything we could think of. Did we have the right urine? The right blood? It should be impossible to test positive on urine and negative on blood. Meanwhile, I finish his regular urinalysis. High white blood cell count, and really high glucose. Elevated white cells means you need to look at it under the microscope, because they probably have an infection. It is loaded with yeast. The man was diabetic, obviously, and had high glucose, sugar, in his urine, along with a yeast infection of the bladder. The yeast was fermenting the glucose to ethanol within his bladder. He was the man who peed beer. A patient being treated for HIV purposefully tried exposing staff members to his fluids. That was a sobering experience. How to put a fake eye back in. A patient came in from a not so nice nursing home with a multitude of problems, one of which was a disgusting, draining fake eye that had to be removed for treatment. Upon discharge, we had to put it back in. Simple enough we thought. But we had no idea how, and struggled to figure it out. I suppose that is why the nursing home staff never took it out to clean it. This was decades ago. Fake eye technology is probably much better today. When my mum was fresh out of nursing school in the year 80s, she got a job at a hospital that had a high concentration of geriatric patients. One particularly frail man took out his dentures before sleeping, then passed away in the night during her shift. His cheeks were so alarmingly sunken in, my mum and another nurse tried to put them back in so as not to horrify the family. However, rigor mortis had already started to set in. She said nursing school definitely did not prep her for that nightmare. How to react when a patient's bowels pop out of their incision. This happened when I was a brand new nurse, but off orientation. Quite a learning experience, but came in handy, because a few years later it happened to a different patient, and I knew what to do. You have to keep the bowels very moist, cover with sterile gauze, and patient is rushed to the OR. Edit. I am glad this was taught to some of you in school. I remember learning about it, but never learning what to do if it happened to a patient. Student nurse here. How to hide looks of shock when something very surprising or awkward occurs. I remember one time a doctor grabbed me when I was in the hall to hold something for him while he was putting a patient's prolapsed rectum back in. Awkward. Nearing completion of an air contrast barium enema on an extremely elderly patient. Out of nowhere she starts saying call Rochester Funeral Home. I'm dead, call Rochester Funeral Home, I am dead. She repeated it no less than 10 times. Respiratory therapist here. How to act when we unplug the ventilator to let go a patient, especially when the family is around. To their defense they do warn us, it's going to happen, but it's never until you actually do it that you realize the weight. I like to talk to my patients, even if most are already brain dead at this point. Although I did have to unplug conscious patients, that was hardcore to say the least. This gives me a sense that at least, if even a small part of their consciousness is still alive at this point, they know they are not alone. I tell myself that at least from now on they won't be suffering anymore. Wow. So many things. I think one important thing that was never taught is how to deal with a patient dying for the first time. I cold not stop picturing his last breaths, the yelling of his family, all of it played through over and over. Hospice is tough, but it still is one of my favorite jobs I have ever done. On behalf of my husband, no one tells you how many low-income women will go to the complain of abdominal pain, go through an exam, and have different tests ordered because they can't afford a home pregnancy test. They never really tell you how to cope with being berated by family members, patients, and even co-workers. Part of being a nurse means that you realize you are dealing with people at their most vulnerable, at the worst time in their lives. And you know this in the back of your head. But being an emotional, and sometimes physical, punching bag for days at a time, requires a certain mental toughness that you can never really prepare for. Digital disimpaction. I can only imagine the partnering instructions for that. No one poop for 2 weeks then come to class and buckle up. I heard this story from a SLP. Always keep a clear exit. She was working with a stroke survivor, set her at the workspace, and walked around to the back of the table with her back against the wall and facing the door. Suddenly the little lady says, I know who you are. Yeah, the lady who has been sleeping with my husband. Suddenly this lady has lunged across the table and is legitimately trying to kill the SLP. Luckily lots of other people came. When she screamed code blue, she cold not think of anything else at the moment. RN here. For me, the most surprising thing has been seeing firsthand how peaceful it is for a patient to be able to choose when and how they will die. I was present for the first medical assisted suicide on my unit. The patient had his loved ones surrounding him, and we all watched as he said goodbye and shortly after took his last breath. In my area of nursing, patients get better and go home. I always viewed my work as a means to make people better. It has taken me a while to process his decision. It was beautiful and peaceful, and really made me look at nursing in a different way. I care for people to help them live, but for this man I was able to support him through death. I was never taught about sundown syndrome until I was working with the elderly in a hospital setting as a student nurse. I had the sweetest elderly patient in my care until about 4 p.m. that day, he suddenly became possessed. He started screaming and hallucinating, and was not the man I had been providing care for earlier. I was so befuddled when the nurse I was shadowing told me he had sundowners, and explained it to me. Lady asked me to name her poop. She was dead serious. Nursing school definitely did not prepare me for that one. They never teach nurses how to express/manage expressions in unexpected or poor situations. I personally have no trouble hiding everything, but watching people around me and the people, patients, themselves tend to ask me what's wrong with that nurse/doctor. Me being able to keep such a straight/relaxed face and expression helps everyone around normally. Being able to explain something bad without a panicked expression is an invaluable skill, which can definitely be learned/taught, though nothing can prepare you for some situations. I can say I can't remain relaxed with I see a high-risk person self-remove a trash tube. Obligatory, not my story but my grandmother's. My grandmother was a school nurse at an elementary school. They were letting the kids out for the day and all of the kids were waiting outside for the day. One little boy's mom came to pick him up. As she was walking up to the building, she began to have a heart attack. My grandmother began CPR, sent someone to get the defibrillator, and told another teacher to call 911 as you're supposed to do. She passed before 911 arrived. I don't think twice her time in medical school cold prepared her for that. My mother was a nurse who cared for elderly patients in a very rural part of England. Here's a few her favorite stories. One was a lady who decided to help clean the windows. She used the food from her dinner as soap and napkins. There was a fun mess to clean up. Another was 3 gentlemen who spent the night calling out for their wives. One was named Edie, one was named Emma, the other was named Elspeth. She said that was one of the longest shifts ever. Finally, she said most of the elderly men were completely clueless when it came to ordering their dinners. They would always say something along the lines of "that's my wife's job." She used to just order them the basic meat and 2 veg option, and rarely got complaints. Whatever your granddad would like usually was the safest bet. My grandfather was a farmer. That dead people can still fart. Middle of the night, all alone with the body, and you hear that. Scared the hell out of me. As a sonographer, I have to keep a poker face a lot of times when I'm seeing something very alarming or sad on the screen. Luckily, most people have no idea what I'm looking at, so that's a plus. I'm not allowed to give any results to patients. Doctors deliver the bad news, so I have to stay neutral. It's really hard. Had a 60-something-year-old female patient show up for a same-day appointment to establish care from out of state. No medical records, denies any major medical history or medications, never smoked, drank, or did drugs. Midway through the exam she starts telling me that she is seeing evil lines all over her house. states she is unable to cross these lines and thus unable to access parts of her house, for instance her bathroom. Hears voices coming through the walls. Feels shadows at night are demons. Thinks the neighbors are hexing her all the time. Starts talking about the occult and Freemasons ruling the world. Suddenly stops mid-sentence, stares at me without blinking, and wants to know if I could perform an exorcism. Sorry, missed that section in medical school. Vet tech. In the past, there was this big bulldog whom we sedated to remove an oral mass. The dog was intubated and the cuff at the end of the tube was fully inflated. That said, the dog managed to somehow swallow part of the mass and started choking on it. Right away I took all 120 pounds of him and turned him upside down, shaking him all over the operating table, trying to make him regurgitate the mass. Eventually I succeeded, but had a back pain for the rest of the day. Lesson learned. Gotta work on my core. So many things. I'd say the chief thing we're not prepared for is just how cruel, bullying, and inhumane our own colleagues can be, not just to each other, but to patients and families. We are absolutely not taught how to handle the stress of our jobs, not given tools to deal with that one raging asshole coworker who just does not pull their weight, and not taught how to de-escalate a family that has just been antagonized by an overstressed burnt out nurse, physician, aide, tech, etc. I have worked as an EMT, a tech, and now as an RN, and I can say without fail that more stress in my job comes from baloney from coworkers than anything else. Maybe I work in the wrong hospital. Long story short, resident at nursing home had hemorrhoids. They were noted to be bleeding at the beginning of my shift. Stated to Mike Nass to notify me when they change her so I can scale the amount. Orders for the medicine was sent in. Nothing from the CNAS. Resident was fine. When I check on her, pass on info to next shift and go home. Get called into the office next day to be yelled at about it. I followed protocol and charted accurately. Medicine is not available at this time. None in backup. So they then and me, why didn't I put an ice cube in her? An ice cube, I exclaim. Yes, they say. Didn't you learn that in school? No. We have to have orders from a doctor for a cold pack, let alone pill at an ice cube where the sun doesn't shine. Paramedic here. They don't give you a class on telling families bad news such as in the death of a loved one. I found over the years, if you come out and say so and so is dead, literally using the word dead, people understand it better. It's brutally honest and not beating around the bush. I don't use passed on or in a better place. I'm not a religious person or even remotely spiritual, so I don't say religious crap. It's not place to do that. I just give them the facts. Doc here. Infant, 2 months, came in unresponsive. Despite our best efforts, there was nothing we could do. In that situation, we have to assume the worst despite the mother's story, and the baby must be examined and sometimes scanned to check for evidence of abuse. Had to wing it as I took a dead infant from the hysterical and extremely upset mother shouting at me in a language I didn't understand. To this day I will never forget those screams of pain. Parents, please don't let your infant sleep in the bed with you.